Bruce, baby cat. It's very nice to meet you both. My name is Dr. Perez. Yes, of course. Thank you so much for coming into the office today. It looks like I have you in for just a very brief, basic overview examination. Have a look at you and make sure that there's nothing concerning going on. All right. Do you have any questions before we get started with your examination today? All right, just bringing my tools over. So if it's all right with you, I would like to ask you a few questions before we get started. Okay. So just a couple things to go over, make sure that there's nothing concerning that I should be aware of. So as far as your feeding schedule, is your owner feeding you minimum twice a day, morning and night? Okay. And I hope we're not getting treats too frequently. A treat every now and then is okay, but everything in moderation, preferably protein-based. Okay, very good. It's good news. And how is your bowel schedule? Are we having bowel movements regularly? Okay, and she's keeping up with the cleanliness of the litter box and everything, reducing the risk of bacterial infections, that kind of thing. All right. And as far as your day-to-day activity levels, are you fairly active, mostly sedentary? What does your day-to-day schedule look like? Okay, so mostly napping throughout the day and then maybe some playtime activity here and there if she initiates. Okay, all right. There's nothing wrong with that. On average, you should be getting anywhere from about 16 to 21 hours of sleep. So as long as you're up and around, repositioning every few hours, getting that blood flowing, keeping up with your mobility, that looks okay to me. All right. So did you have any questions for me before we get started with the physical portion of the examination? Okay. And do I have your consent to proceed today? I will be touching you here and there using some various tools. All right. Okay. All right. So let's go ahead and get started now. As with all of my examinations, I like to start with a basic visual inspection. So this is called a pen light. Now it is very bright and it can damage your eyes. So I don't want you to look directly at the light. Is that okay? So you can kind of just look around the room or you can focus on me. Just don't look at the light. Okay? All right, Bruce. Is it okay if I call you Bruce? Do you prefer Mr. Wayne? Bruce is fine. Okay. All right. So I'm just going to have a brief once over, kind of having a look at you here. Thank you so much. It's very good. So having a look at your ears, eyes, your nose and mouth, as well as your upper and lower extremities. Look at the tail health as well. I'm just going to have a look inside the ears briefly. Look at the external ear canal. Do see a bit of slight discharge at the nose, which is normal. Whiskers are intact, nice and long. Do hear some purring, so it appears as if your lungs are functioning adequately there. Now, I will say that I see your back claws could do for a little trim. All right, I'm just going to check your front claws as well. Yeah, just looking a little long there. Pads look okay. Can I see your left paw? Again, just a little bit long there. All right, so I am noticing a little bit of shedding on the bed, so it does look like you could do for some grooming. So thank you for turning, Mr. Wayne. I'm just going to have a look at your belly. So looking for any signs of abnormal distension here, which is not notable. You are rather plump, but I wouldn't say anything too concerning. You do have the lower pouch consistent with a cat of your age, so that is a good sign. And looking at the lower extremities as well, again, those back claws are just a little bit long for my liking. All right, now baby cat, if it's okay, I would like to come over and have a look at you as well. So just doing a basic inspection here to start with. Ears are very well spaced, not noting any signs of asymmetry there. coat is nice and thick. Okay. Just gonna have a look at your external ear here. Nose and mouth. Very good. Whiskers are intact. Do you see some slight discoloration at the lower chin there? It appears as you've been scratching your face on things that you shouldn't be. Okay. Something of note there. Having a look at the paws. Murder mittens do appear to be intact. Could definitely go for a trim. Okay. And the belly as well. Slightly distended here. I do believe maybe talk to your owner about portion control. Okay. All right. And again, hearing lots of purring. Lungs appear to be intact. Having a look at the tail. Very nice. I will assess gait while you're up and moving around. If I could just have you walk this way and then this way. Thank you. Very good. All right, so that looks okay. If it's okay with you, I'm just gonna test a couple of reflexes while you're standing. Okay, you'd rather lay down, that's fine. Okay, so reflexes are intact. I will say you are a bit skittish for my liking, but that's okay. All right, Bruce, slightly more well-mannered there. Much appreciated. Now let's see. The next thing I'd like to test is for temperature variation. Now it is very important that we make sure that there's no abnormal temperature happening. So I am going to test a couple of different areas here. Just going to make sure that there's nothing particularly concerning going on, especially the underside, looking for any signs of swelling or inflammation. All right, baby cat, I will have a look at you as well. Yep. Nose temperature appears to be intact. Very normal range there. Okay, slightly warmer at the abdomen again. All right. Nothing that I would say is overly concerning so far with either one of you. Now, I am noticing quite a bit of spacing on the table here. Is that something that we're doing subconsciously? Is there a bit of a rift going on? Okay, all right. Interesting. So just taking a mental note of that. Now, I would like to go ahead and have a bit of a closer look here. So this device is called an otoscope, and it just has a light on the end of it. It allows me to have a bit of a closer look at some of the orifices of the head. Okay. So checking cranial health here, I'm going to have a look at the ear. Bruce, I'd like to start with you if that's okay. All right. So I'm going to have a look in the ear, starting with the right ear. Ear canal is very clear. No signs of abnormality there. And the left ear as well. Looks good. Just going to have a look at the nose. Nice and clear. Okay. And if I could have you open for me, Bruce. Let's open and say, ah. Very good. All right. So it does look like baby cat has decided to leave the examination, so I will be documenting her as leaving against medical advice. That is well within her rights as a patient. We will just proceed with your examination today, Bruce. So I would like to follow up with a brief heart and lung assessment. Now, not sure if you're familiar, this device is called a stethoscope, and this is going to allow me to listen to both your cardiac and pulmonary health. Okay, so I'm going to start by coming in here just underneath the left arm. Very good. Very well perfused, yes. Listening for any signs of occlusion, any abnormalities in heart rate or rhythm. So listening for both tachycardia and bradycardia, either a too fast or too slow heartbeat. So far, neither of which are notable. Also listening to your lung health. Very healthy purrs. So far, not hearing anything that I would consider abnormal. Good. Have you take a deep breath in for me, Bruce? Very good. And out. And in. Good job. And out. Good. Now listen here right at the carotid artery. Just go ahead and breathe normally for me. Perfect. Okay. Now, very standard test of the lungs here. I'd like you to purr louder when I tap twice. Good. Can you say meow meow? Meow meow. Meow meow. Meow meow. Very good. And lastly, meow meow. Very good. Okay. So all of that sounds normal. Okay, so didn't hear anything concerning. Cardiac health appears to be intact. Pulmonary health was well intact as well. Very healthy purr there. So that is all good news. Now, I would like to follow that up with a few measurements, if that's all right with you. So this is just standard measuring tape. Okay. So we're going to go ahead and measure the cranium here at about 10.5 inches. And ears appear to be symmetrical at about a 1.5 inch length there. I'd like to measure your arms as well. Oh, are you assisting? Thank you so much. So fairly symmetrical there, maybe some slight asymmetry on that right side, and torso length I would say again is about average. So that's a very good sign. Now let's go ahead and test for basic sharp or dull variation. So I have a couple different tools here. Now this one is just a standard cotton swab. And this one is more of a blunted metal tool. Now, are you able to distinguish between the soft and the sharp there? Okay, so I'm going to touch you with either object, and I'd like you just to attempt to verbalize whether or not you feel soft or sharp. All right. Here. Sharp. Good. Sharp. That was soft. Good. Yep, soft. Sharp. Very good. Soft. Soft. Yes, that was sharp. Yep. Testing at the paw. Yep, sharp. And soft. How about here? Good. Sharp. Sharp. That is soft. Very good. Sharp. And soft. And we test at the back paws there. Is that sharp? Good. And soft. Soft. And sharp. Very good. Okay, so sensory function appears to be intact. I didn't notice anything particularly abnormal or concerning there. So I think the next thing I'd like to do is a bit of a palpatory assessment. Is that okay with you? Perform some palpations, feel around a little bit. Okay. All right, so beginning at the cranium, I am going to perform some facial palpations here. So I'm going to start by feeling around at the top of the head. bit of a scalp examination here, feeling for any lumps, bumps, anything that could be considered concerning. You feeling any pain or tenderness here at all? No? Okay. So feeling along the jawline, testing for any signs of TMJ. Do you ever grind your teeth? No. And no issues with headaches or migraines or anything, correct? All right, that's very good. Can I have you swallow for me, Bruce? Swallow. Good. And one more time, swallow. Very good. So I'm also going to feel around and palpate for your lymph nodes. So checking for any signs of inflammation or possible signs of infection. So we have several chains of nodes that run kind of parallel to the jawline as well as underneath here. Not feeling anything there. Have you had any symptoms of cold or flu recently? No? Okay. All right. So moving on to the kind of upper chest and upper neck area. So just going to continue palpating here along the scapular indentation, not feeling anything concerning there. And moving on to some abdominal palpation here, feeling along the abdominal cavity, feeling for any signs of distension. Yep, thank you very much. That's perfect. No signs of lumping. I do feel normal digestive traction here, lots of movement. It does appear as if you've had a meal recently. So I'm just going to do a little bit of a deeper palpation here, Bruce. I'm feeling for your organs. So just feeling your kidneys. No signs of swelling or inflammation there. Feeling for your spleen. Back feet, let's palpate there as well. Nice and strong. I'm going to have you push like you're stepping on a gas pedal there, Bruce. Very good. And pull. Good. And this side as well. Push. Slightly weaker, I would say, on the right side. Okay. You push with your head, Bruce. Push up. Good. And down. Good. And to the left. And lastly to the right. All right. So that's very good. Bruce, if I could have you stand up for me. Let's stand. I want to have a look at your posture here. Okay. So you definitely prefer a more sedentary lifestyle, which is somewhat concerning. I would like to see a bit more movement, but it does appear as if you have the grooming aspect of it down. So I'm going to have a look at this side now that you've kind of rotated. You wanting to play? Okay, we can test a bit of your hunting skills since you appear to be more awake. Very good. So it does appear as if your bite strength is intact as well as your grip. Very good. All right. Yep, that looks good. Just testing some range of motion. All right, so all of that looks very good. I'll go ahead and, yep, I'm just gonna put that away now. Perfect. Okay. All right, Bruce, so I would say that we can go ahead and wrap up your assessment today. So I wouldn't say there's anything I found that was particularly concerning. Now, I do notice just quite a bit of shedding here. Okay. So this is what would look like a comb. Now, shedding quite a bit here. I'm just going to do a brief once over and see just about how much hair is shedding. Not seeing too much, so it doesn't appear as if it's no signs of alopecia or anything, but could definitely do for some more frequent grooming. Okay. Now, baby cat, unfortunately, you've come at the end of our session and I'm no longer able to accommodate you today. If you would like to reschedule, however, you can head over to the reception's desk and we might be able to get you in sometime next week. Okay. All right. So I am going to go ahead and import all of this information in your patient portal, as well as for Mr. Wayne. Now, should your owner have any questions, she is more than welcome to contact my office. Otherwise, I will get you rescheduled for your annual appointment, and I would like to see Bruce in about the same time next year. Is that all right? Okay. Well, it was very nice meeting you, baby cat. I'm sorry we weren't able to accommodate you to your liking today. I do, however, hope you get home safely. Okay? All right. Well, thank you very much. Good job, my love. Good job. I know, honey.